on your side with tonight's cover story. If you feel like 2020 aged you a few years, you're not alone. And now more people are considering plastic surgery. Surgical procedures increased 54% in 2021, according to a study from Aesthetic Plastic Surgery. The average plastic surgeon performed 320 surgical procedures. That's compared to 220 in 2020. Now that COVID travel restrictions have been lifted, more Americans are traveling abroad to get plastic surgery. It's usually cheaper, but it can also be risky.
The oversight in countries like Mexico isn't up to the same standards as it is in the United States.
Back in 2018, a Texas woman, Laura Avila, died from brain damage after traveling to Mexico for surgery on her nose. The anesthesia was injected into the wrong part of Laura's spine, causing her brain to swell. Her kidneys eventually failed, and she went into cardiac arrest.
Never in my life did I imagine that we would get to El Paso and they would tell us she suffered severe global brain damage.
These botched surgeries aren't uncommon. Dr. Nyame is a plastic surgeon with Charlotte Plastic Surgery. We talked to him about the uptick in patients needing reconstructive procedures after plastic surgery. You saw a couple patients today. When you see those patients come in who have been through the struggles, what's this sort of like for you when you talk to them?
You know, my heart breaks for them. My heart breaks for them because most of the time the reason they sought out discounted plastic surgery is because they didn't have the means. And now they've had a procedure performed. Sometimes just to get healed is going to require more time. The first patient I saw today had to fly back to Florida 4 times. All of that costs money. And then finally getting somebody to take on their case to, at this point, reconstruct them. Right? This isn't just cosmetic surgery. Now it's reconstructive surgery to make them whole again is challenging.
Are you at times talking to a patient saying, you don't need that, you shouldn't do this, and then they go somewhere else?
Oh, I've had this happen time and time again. You know, I think of every patient like a family member. And I tell them all the time, if this isn't something I would do for a family member of mine, this isn't something I'm going to offer to you. Sometimes those patients will feel rejected.
Just because it pops up first on the search engine doesn't mean it's a reputable place, right?
Absolutely. Absolutely. You know, people don't realize that you can actually pay in certain markets to pop up first. And so a lot of people are paying just to pop up first.
How much, too, is this also tied to social media and people seeing what you're supposed to look like these days, et cetera, and they're just trying to find a way to get it done?
You're absolutely right. So you know, social media plays into all of this, right? For the first time in the history of our society, not only are we comparing ourselves with our next door neighbor and the people that we encounter, we're now comparing ourselves to everybody we've met since high school. We're looking at feedback and pictures of people who are sometimes photoshopped, people who have this glamorous lifestyle that is a fake representation of their true selves. And now people are addicted to this because this is their new reality.
If I bring somebody into my house to fix some drywall and they do a lousy job, I can fix the drywall pretty easily, right? In this case, much different scenario. What are the risks? I mean, we know in cases, right, lives have been lost in some cases, right?
Yeah. Tremendous risk. You know, obviously the complication that is most dreaded is just death. Not surviving the incidents. And there have been examples of people who are not board certified doing liposuction and have perforated or inserted the cannula inside the abdomen and caused life-threatening injuries, right? So there are significant risks. Most people don't experience those risks. Most people have issues with wound healing, right? That leads to significant scarring. And the real challenge is a lot of times when people have gone abroad, they don't have anybody to take care of them. North Carolina, and specifically Charlotte, is an evolving city, okay? As more people move in, we are starting to become, you know, a hot destination just for plastic surgery. Luckily, in our area, the standard of practice for plastic surgery is still very high. And so I think most of my colleagues here at Charlotte Plastic Surgery and within the area maintain a high level, a high standard. So we're not seeing Charlotte as a place where people are flying in for discounted plastic surgery. But who knows what that future may hold.
Yeah, really important that you do your research. Tell us your thoughts about this. You can connect with us on Instagram and Twitter using the hashtag OYS Tonight.